It looks like it's live.
Come on, come here.
Good afternoon. Welcome to the CARES event Q&A with me, myself, Takisha. I'm a resource navigator for CARES event, and today we'll be doing a Q&A on COVID vaccinations. And joining me today is Dr. Julia Rosebush.
Hi, it's nice to meet everybody. I work with Takisha and serve as Medical Director of Care to Prevent, and we're really excited to be here today to hopefully answer all of your COVID questions. So please, if you are watching, send them to us. Otherwise, we'll just tell you what we hope we want you to know. All right. So why don't we go ahead and get started? Takisha, do you want to talk maybe a little bit about your journey to getting the vaccine, what was important to you, what your experience was like? Maybe we could start off just talking about our own experiences getting vaccinated.
Takisha, and the reason why first start off, the reason why I got vaccinated because I have a great deal of medical issues, and also too I have toddlers and infants in the house, and my mom, she also has medical health problems too. So that was prompts me to get it because if I get sick, I'm out for quite a while. So that's what prompted me to get it, and also to be an advocate for the African American communities to say, hey, I got it. I'm still here, and I still have my arms, legs, and fingers. The process was easy. How it was set up. Got an email. I got an email, and then I went into my chart and made an appointment. So the process was easy. So I made an appointment one day. Then it was followed by 2 weeks later. I had to go in to get the second vaccine. It wasn't bad. It it wasn't bad. I just my arm was a little bit sore. I didn't experience any fever or anything like that. Nausea. I just had a little aching on my upper arm.
Awesome. I would agree with Takisha. I think that the process was pretty streamless. Here at the University of Chicago, they did a really, really good job notifying if you had access to your My Chart, really easy to make the appointment. And then, obviously just getting to the clinic. The injection itself was, I thought, and Takisha, I don't know if you felt the same way, but it was painless, which I've never had a shot that was painless before. But both of them were, so it wasn't just a fluke the first time around. And really arm soreness was the only thing that I happened to note, mostly on like the day after that just went away. And you can take some Tylenol or ibuprofen or whatever pain reliever you feel works best for you, and that won't, cause any problems with the vaccine itself. So that will help your arm feel better, and doesn't interact with the shot at all. So
We have some questions coming in, and I'm gonna leave this one to the medical professional to answer this one. Should I get vaccinated if I already had COVID?
So that's a really great question, and a lot of people are asking this, and the question is absolutely yes. However, it all depends, the timing of when you would get the vaccine or the shot would depend upon when you were infected, and then you would make the plans to get the vaccine thereafter. So that definitely, if you've had COVID infection, that's definitely something that you would need to talk to either your doctor about or another medical professional about, so that they can inform you as to when you should actually receive the vaccine. One thing to remember is that whether you have been vaccinated or whether you have had infection, neither at this point in time confers lifelong immunity, meaning that the immunity that you had from getting infected is likely to wear off. And so the shot will actually help to continue that immunity for a longer period of time. We don't know exactly how long that's reported to last at this point in time, but certainly individuals who had COVID earlier on in the course of the pandemic should absolutely be vaccinated. And it's just a question of when. And that's something that can be decided on an individual basis with your healthcare provider. Hopefully that answers that question.
Thank you, Julia. So the next question, it said, how can I know that this is a safe and that we aren't just guinea pig? So for any vaccine that you get, you always know that it poses a risk and that they're not 100%, is not 100% proof. Anything that say 99.9, 98.9, you know you're gonna fall in that 1% or that 2% category. So it's always good to know that even if you think you're being led as a guinea pig, get a COVID test before you're scheduled to come in and get vaccinated. Get one in between the 2 weeks. In between those 2 weeks, while you are waiting to get your second vaccine, and know that any vaccine that you get is not 100% foolproof.
Yeah, I think Takisha brings up a really good point. So really nothing is guaranteed, and nothing is 100% effective for the most part. The vaccines that are available to the general public, both Moderna's vaccine and Pfizer's vaccine in clinical trials, are approximately 95% effective, which is really, really fantastic. And I think it's really important to let the community know that the safety of this vaccine has been the top priority, not only by those who are manufacturing and distributing it, but by those of us who have who are in the medical profession, who are recommending that people get this vaccine. No steps have been skipped. I've been asked a lot of questions about, well, how is it that we've been able to get a vaccine in record time for this virus? But no steps have been skipped along the way in terms of developing the vaccine, testing the vaccine, and marketing the vaccine, giving the vaccine. It's really important to know, and that the FDA, the Food and Drug Administration, the organization that oversees this development process, has been involved every single step of the way and would not put to market. And as medical professionals, we would not advise if we felt that safety was questionable. The safety data, or all of the results that we've seen with respect to the safety of these vaccines, looks very, very positive overall. So we're really, really happy with what data we have thus far, and don't expect that to change dramatically in the future.
And also think I can add to, if you feel about getting vaccinated, the most important thing is do your research. The place that you're going to get vaccinated from. So say like you're going to UFC, find out who, what company UFC is using for the, whether it's Moderna or Pfizer. Get do your research on it. So ask questions like, okay, what's in the vaccine and things like that. Do your research on it so you won't feel like you just walking into a spot that you're blindsided. Do your research on it.
Absolutely. So there's a question, how can we ensure equitable distribution? I'm not exactly sure what's meant by equitable distribution, but the way that I interpret that question is, how do we make sure that we get the vaccine to all of the people who need it? And we know historically that our communities of color, our Black African American communities, our Latinx communities, are those who have been hardest hit by this pandemic, and have had a greater number of deaths and severe cases as opposed to the white population. And so when we talk about equitable distribution, I think a lot of that, and Takisha, I love your comments on this as well, but it's about finding trustworthy sources of information. Like Takisha said, do your research, talk to people who you know, reach out to your doctor if you have one. If not, there are a lot of really, really good online resources that one can access that contain factual information. I was really excited to get an email today from the university stating that of all of the people that have received vaccine here at UChicago thus far, over 50% identify as underrepresented minorities, particularly Black and African American, which is really exciting to hear. So I think that in order for people to get vaccinated, they need to believe in the process and they need to get trustworthy information. The vaccine will be available for you depending upon your risks and when you're scheduled to get it. But I think it's really about making sure people have the information that they need to make the best decision for themselves. Takisha, I don't know if you have anything else to add to that, but
Well, I like to add, if that was a good question to ask, it's just the fact that when you're going to get when you go in to get the vaccine, know that there's no, when you go into the room, right? They don't have oh, Takisha's an African American, Julia is Caucasian or Hispanic or whatever. So when you go into the room, when I went into the room, as I walked in, I walked up to the registration, and it was like whatever room that was available. So they wouldn't know what your race is. So if you feel like um you is not trustworthy, when you make your appointment, you don't have to necessarily put your race on there and say I'm African American, anything. So if you feel like, okay, they're not going to give African Americans the same type of vaccine they're giving the Caucasians and stuff like that, do not put your race on there. So if you feel like that's going to be one of the issues too, if you do not understand a lot of the information, please talk to your local healthcare providers to let them know that, hey, I don't understand the process. So there could be many reasons to where mistrust come in, because if I don't understand the information that's being given to me, or if I'm not 100% sure that I fall into that category, please talk to your local healthcare provider, or if your local healthcare provider is not giving you information, contact CDC. They can help you with those guidelines to understand, are you within a priority. So don't just sit there and say, oh, we're not gonna get it. Ask for help from any healthcare provider that you might not that you say, I need help, and we would be lucky enough to help you. If you want to reach out to Care to Prevent, where we can get you the proper information that you need on, do you fall into these guidelines, or getting a vaccine, just reach out to us. We'll be more than help you to guide you into the right place.
thanks, Takisha. I love that you put in the plug for C2P, because we would definitely love to be involved and point you in the right direction. Despite us being affiliated with the University of Chicago, we're not the only organization in the city that's providing services with respect to the COVID vaccine. So would be happy to help you just navigate that if that was something that you felt that you needed. Another question that's come up here that's somewhat related is, what if I don't have enough money to pay for a vaccine? So you shouldn't be paying for the vaccine. That should all be taken care of by the government. So please do not pay for a vaccine. If anybody tells you, hey, I'm able to get you a vaccine if you just pay $50, et cetera, you should not be required at all to pay money for this vaccine. This is not something that is going to get billed to your insurance. It's not something that pocket. And if any of those things do come up, you should definitely question the legitimacy, or how legitimate is this whole process, because this vaccine is being offered to all people free of charge, and that's just how it should be. So don't believe anyone who might come up to you and say, hey, I can get it for you for a price. That definitely shouldn't be happening. It just shouldn't be happening. There is another one that says, should I wait until the Johnson & Johnson vaccine comes out, so I only have to take one shot? So I do not know when they expect the approval or the emergency use authorization for that particular vaccine to come out. I agree, getting one is better than getting two, and it all depends on timing. Certainly, if you have an opportunity to get vaccinated before we get any information about when this vaccine may be approved, or at least approved for emergency use, I would go ahead and get the 2-dose series. I would not wait until this is approved in any way, shape, or form, because we just don't know what that timeline is looking like currently. And I would hate for somebody to miss their chance at getting vaccinated, and potentially decreasing risk to others while waiting for approval of a different vaccine product. So if you get a chance, the first chance you get, that would be great.
The next question says, yes, I've heard people say that you can't find the list of ingredients in mistrusting it that way, but can you find the ingredients? If you want to, like I said, if you wanted to find the ingredients for it, you also can look it up from the Food and Drug Administrator, or also I believe you can contact CDC for it, so you can get those ingredients, because we don't want nobody to have an allergic reaction to those ingredients, or if something in the vaccine. So say like if you're a person that cannot have much potassium, that one of those vaccines might not be a good choice for you. So yes, they are available to find the Food and Drug Administrator, and also try to contact CDC. You have any feedback?
Yeah, no, there's nothing hidden in the vaccine. I do want to comment on one thing that I think a lot of people have heard, and I just want to kind of dispel the notion that it exists. But the way that this vaccine works is that it's contained in something called a nanoparticle, which is really just like a fat layer. And the only reason that that exists is because it needs something, the vaccine, the part that works, needs a way to get into the body. And so as soon as it's injected, this kind of fat layer dissolves, and then the vaccine goes to work. It doesn't come into our genome. It doesn't alter our genetic material. It doesn't do anything frightening to our bodies, in the sense that people were very worried when people started talking about the technology that this injection was somehow going to interact or interfere with our DNA or our genetic material. But I'm here to tell you that you can rest assured that that is absolutely not the case. It's not a live vaccine. It's not live COVID. Nobody's injecting live COVID. There's all these things that I think people are worried about when they're getting the vaccine that are happening to them. When I got the vaccine, and Takisha, hopefully you got like some paperwork with it too. It was basically a question and answer sheet. It was, I think, a couple of pages in length that really kind of talked about the vaccine itself, what it was made of, what you might experience at certain intervals after you got the vaccine. It was a lot of information that was really, really helpful. So.
The next question is, should I get the vaccine if I have HIV? When will I be able to get vaccinated? Yes, you should get vaccinated if you are HIV positive, because you are considered high risk. And I'm going to let Julia take over that question, because she's our pediatric
You're
doctor.
right.
So
No, Takisha, you said it right. In fact,
she will explain more to you why, other than me saying you are at risk. So.
Yeah. No, but I attended a talk today. It was an HIV breakfast club, actually, and one of our U Chicago docs on the adult side was there talking about, in the adult population, what the recommendations are. And, unless you are not on medications and you have a really, really high viral load, you're not in care, and are really immune compromised, we are absolutely recommending that when it's appropriate, people get vaccine who are living with HIV. As you mentioned, people that have undetectable viral loads, who are on medications, who are otherwise well, absolutely no risk to them from getting the vaccine. The only people that I would caution are those people who are either undiagnosed and living with HIV, or who've not been on medications, because we know that, individuals who have less immunity have a harder time making a response to the vaccine. And so that should definitely be something that those particular people are talking about with their doctors to see what they can do to get themselves boosted up a little bit immune wise before they have the vaccine. So those are the only patients in whom we'd, maybe expect, worse courses of COVID in, or we would, expect that maybe the vaccine won't work as well. So definitely we want everybody living with HIV to get it. Just talk with a medical provider if you are living with HIV to determine what timing is going to be the right timing for you.
So we know that there's a strand that going around with the COVID vaccine within a pediatric. So as fathers, as we saw that, I think believe it's 18, 16 or 18 that they will be given vaccine. What about for parents that have little babies like that's 2 years old that's highly high risk, kids that's 5 years old that's high risk? What are those parents are being told?
It's a really, really good question, Takisha. And as a pediatrician, obviously, like when can the kids get vaccinated is on the minds of friends, family, patients, clients, right? Everybody wants to know. And you're right. Right now, we have data down to the age of 16. And we are currently studying the vaccine in a much younger age group. And we would hope to have some information out. I would hope late spring, early summer, but it may be a little bit later than that. The goal is that we would obviously want to immunize everyone, irrespective of age, but before we can start administering or recommending it to younger children or children younger than 16, we have to take a look at the preliminary data that's coming out of the clinical trials, and that's going to be a little while yet. So I wish I could give you a firm timeline of when we could expect to get that go ahead or that green light, but we just don't have it quite yet.
Next question is that how long will immunity last within the COVID vaccine?
It's a good question, and I think the verdict is really out, or the jury is still out. We don't have a verdict yet. I said that incorrectly, so sorry. So we know with natural infection, immunity can be anywhere 4 to 6 months ish is what I have been reading and been told. And I think that we've not been vaccinating people for long to know exactly how long immunity is going to last. So does this mean that we will need to get vaccinated every year as opposed to once in a lifetime like we do for some other vaccines that we receive as a part of kind of our normal schedule? We still don't quite know that data yet. One thing that I can say, however, is that we don't want people who receive the vaccine and who are then fully vaccinated to stop the mitigation efforts. So mitigation efforts meaning masking, distancing. This vaccine does not prevent someone from getting COVID. It prevents you from getting severe disease. It prevents hospitalization. It prevents death. It cannot decrease the likelihood that you might receive COVID from somebody else, be asymptomatic or without any symptoms, and then transfer it or pass it on to another human being. And so even after you're fully vaccinated, which is now 2 weeks after your second vaccine, we still are asking that you mask and that you distance so that people who are not vaccinated or people who are at high risk aren't at risk if you should have COVID from passing it on to them. In that same breath, I will say you cannot get COVID from the vaccine. It is not a live virus that is being injected. It's an inactivated virus, and therefore it has no ability to cause actual COVID illness.
It say, will the vaccine prevent me from being able to get pregnant? The answer to that is no. You still would be able to get pregnant. CDC says that pregnant women carry a much stronger. It's how do they say it? They said I know when a mother has COVID, she would be able to pass it on to her child. So they recommend, they advise pregnant women to get the vaccine so they would not be able to pass it on to their baby. So you can still get pregnant. It has not been proven that you would not be able to get pregnant once you get the vaccine.
That is absolutely true, Takisha. I don't really have any other sort of medicalese to add to all of that, but you're right. All of the medical organizations who work with both, pediatric patients as well as with mothers, they are all recommending that pregnant women receive the vaccine. And they're currently collecting data on what that looks like. But I have a number of people in my life who I know are pregnant and who've received the vaccine and are doing absolutely fine. Pregnant women are immune compromised in a sense, right? I know we don't think about it always in that way, but they're definitely at much higher risk of getting severe disease from flu and from other infections. And COVID-19 would be expected to be similar. And so, to provide protection to both the mother and the baby, it's really important that they talk with their doctors and talk about the importance of vaccination.
So can I still get COVID even if I'm vaccinated? Just like any other vaccine, COVID is a more so of a prevent, like she said, a prevention. It does not stop you from getting it. It stops you from getting it in a severe. It's just like if you got the flu vaccine, you still might end up with the flu, but you might not end up with it as severely if you did not get the vaccine. No vaccination is 100% effective. It always have that 99.9, and you might fall into that 1% category. So don't be upset. Say, oh, I wasted my time getting the COVID vaccine, and I still get and I still end up with it, or some like the flu shot. Oh, I got the flu shot, and I still end up with it. It will not be as severe if you did not get it.
You're absolutely right. You're absolutely right, Takisha. I mean, it doesn't prevent against that asymptomatic transmission. Again, it's there to protect you from, passing it. It's there to protect you from getting severe disease, fatal disease. And we've got a long way to go. We've got a lot of people to vaccinate before we really start to see how this is going to impact our public health in the United States. And so we really hope that, as the vaccine gets rolled out, more people will see that others have done well with it. As you mentioned earlier, you're still standing, you had no severe side effects. And that will encourage more and more people to take up the vaccine.
Question said, is there anyone who should not get vaccinated? That's a question that should be left up to your PCP, because for the simple fact is we're not going to tell you everybody should get vaccinated. So if you go talk to your primary care provider, it might be something within that vaccine that will cause you not to be able to get it. So that's a question that you need to talk to your healthcare provider about, because we don't want to give no misinformation here at C2P. That's a question that, like I said, address with your primary care provider. And then they say, what is the herd immunity on how many people need to be vaccinated to get there?
I can take a stab at that one. I've been watching a lot of Dr. Fauci, so I'm going to channel him in my response. I could never be him, but so we need, for us to see the impact of this vaccine on COVID transmission in this country, we really need to get 70 to 85% or more of the population vaccinated. And right now, the data is that we're at 2%. Not going to get into a whole lot of discussion about why it is that we're only at 2%. It's very multifaceted and a very layered conversation. And some of that is vaccine hesitancy or refusal, but a lot more of it is access and having the vaccine to the people that need to get it first. And the states are really at this point needing to sort of devise their own plans for how people are going to get this. And so I know that there was a question a little earlier about how do I know when it's my turn to get vaccinated? And as healthcare providers who give the vaccination or recommend the vaccination, all of our guidance comes from our health department. So CDPH, or the Chicago Department of Public Health, is the person who receives the vaccine and who distributes distributes it to the various healthcare systems under its jurisdiction. And then hospitals employ a policy that they've devised. And typically this would be starting with frontline healthcare workers, those with immune compromising conditions. And as Takisha said, you'd need to talk with your doctor or healthcare provider to see if you qualified. And then elderly. So we started with, 75 and older, went to 65 and older. And so those who are otherwise healthy and are part of the public who don't have frontline facing jobs, they would be considered later on. And we would get guidance from the health department as to when persons in the city of Chicago would actually be able to get vaccinated. So we kind of wait for people to tell us a little bit more about that.
This is a thick one. It's a microchip in the vaccine. I think you covered this, but I just read about 28% of Americans think there is a Bill Gates microchip, and 40% of Republicans do. I mean, as far as to what people beliefs are, we can't not change the minds of what people beliefs. But when there's science and data out there to inform people, I cannot deteriorate from your beliefs. I cannot tell you something different because that's your belief. And I don't want you to say, oh, from character of events, say this. No, those are your beliefs. But like I said, do more research, talk to more healthcare providers, talk to people that have gotten the vaccine and get their input on it. So anybody believes, we can't disturb your beliefs. We just can't. That's what you believe. But we are here to inform you that the safeties around getting the vaccine.
I agree 100%. There are a lot of differing opinions and beliefs, as Takisha said, about this vaccine. Unfortunately, a lot of this has been steeped in politics, which just further complicates, efforts to get credible scientific data out to the public. Go to the people that you trust. Go to people in your community who may have had the vaccine, as Takisha said. Be open to hearing about where you can go online and through the internet to get reliable and credible information. I think that there are a lot of myths and a lot of notions about, what the vaccine does and does not contain, but there's a lot of great places to go where you can get factual, actual data that will hopefully help you to understand sort of what the science is behind the vaccine. How can I convince my 70-year-old auntie to get vaccinated? Takisha, have you talked to any of your family about, I'm having a really hard time with some of my family members, and I've, kind of given up a little bit, but I'm curious as to what conversations you've had with your family.
I think it's so much with the hype of it from the media. With the hype of the media, my mom, she's a diabetic and she's hypertension. And I told her it was no choice. I said, you don't have no choice in getting it. Yeah. But it also too, I asked her, what is her issues? What is her issue? What is her issues with getting it? And it's just like basically the things that you hear the things that you hear on the TV, as far as to things like African Americans is not getting the same dose. My doctor is not telling me I should get it. Why should I get it? Things surrounding that nature. And all I have to say is address those concerns. So why your auntie don't want to get it? She might heard that her 60-year-old friend got it and it didn't do too well, but know that each person body responds differently to the vaccine. So that's what it is. Your body responds differently. What I might have did where you might not have done, where each body responds differently. So don't let that stop you from wanting to get it if you want to get it, because somebody that you knew didn't have a good reaction for it?
I think that you kind of hit the nail on the head, Takisha, when you said, really try to see first what the basis of the hesitancy is. Is it that they had a close contact or friend who didn't do well? Is it that they heard something on the radio or TV that made them worried? Is it something they read online? Because I think if you have that information, you'll know best how to go about providing them perhaps with some information that will open their mind to another point of view, or another perspective. And certainly at the age of 70, we want those particular individuals to get vaccinated since they are elderly. Though the older I get, it doesn't seem so elderly. They are elderly by technical definitions, and they're therefore more at risk. So I agree.
I say not sure how to address the profit piece that could get a little more challenging, but it was a good question. So understand this: no healthcare provider should be asking you to render any payment for this vaccine. So they should not be asking you for money. When you go get the vaccine, I'm going to make it clear. They should not be asking you for money. So they say this vaccine, you have to pay $150 for this vaccine upfront. No. Find somewhere else to go. And as far as if they asking you for cash up front, we'll put your debit card in. Please, we going to try to get some information where who to contact if you have gotten to this point. If somebody's asking you to put in credit card information or you paying cash up front for this vaccine, they should not be asking you for any money for this vaccine.
I have nothing to add to that. I agree with you 100%. We definitely are excited at the prospect, or at the fact. I shouldn't say it's a fact. I'm really excited that there isn't any strings attached to this when it comes to money. This is something that you are being given, and it should not come with any financial strings attached to it whatsoever. That's it. I think we've answered all the questions. Takisha, any other, I don't know, words of wisdom or things that you can think of that people may want to know about?
Like I said, like we can go back to the mistrust part with the African Americans, like going back to, okay, one, knowing how to advocate for yourself. If you do not know how to advocate for yourself, find somebody that can advocate for you. So whether if you're talking to pillars of the community, like your local aldermen, like your local nurses, and somebody that you worship with, somebody that you can talk to say, hey, I would like to get this. And knowing that everybody have a different opinion. I might say yes because I wanted to get it. And a person next to me might say no. We all have different opinions, but we also too are our own judgment, and we have to weigh out the benefits of why we get it and why we don't get it. So if you know you high risk and you know you want to get it, don't let somebody else be the judgment for you for why you didn't get it. Like I said, do your research. Go back and if you're going to UFC had used Pfizer. So look up the ingredients. If you don't trust the ingredients they gave you, if those ingredients is not matching what the FDA say, report it. You think things like this, so you're not out here getting fake vaccines, because it has been some things going around, and heard say somebody made a vaccine within a day. So yeah, so you don't want to be getting the wrong thing, and make sure that the person that you getting a vaccine for is registered with FDA and things like that. They have is it the DA number that you all have for doctors?
Yeah, so we can prescribe medication.
Yeah, so make sure that person DA number is legible when you're going. So knowing all these things about the person that you're getting the vaccine from, you have to just do your research.
I think self-empowerment is really great. And I know you've said that quite a bit here, but I can't overestimate how important that really is, you know, you should be a part of your healthcare in all ways, and be as educated in your conditions and your body as you possibly can be, so that you know how to have these conversations with your provider, and to, you know, take charge and take control of your own health. I think that that is so important. One thing just came through: will the government make us get the vaccine? That's the other thing. Nobody should be asking you for money, and nobody should be forcing you. Of course, as a healthcare provider, I would love for everybody to have it, but nobody can force you. The government is not going to make you take a vaccine. No vaccine is mandatory in a sense, right? You have the power and autonomy to say, nope, I'm not going to take it, and that's going to be that. Nobody will force it upon you.
That is certainly true. Uh, your your job can't say, "Oh, if you don't get COVID vaccinated, you can't come back to work." No, nobody's forcing. This is a volunteer vaccine, just like any other vaccine. Nobody can force you to get these. We can not. Uh, if you don't want to get it, you don't want to get it. We would just love for you to have it, but you just don't want to get it. Your beliefs is your beliefs, and we have to do our part into respecting that in all human life.
Agreed. And I think, you know, if you choose after all of the information, if you choose after reviewing everything and making your decision, and you choose not to get the vaccine, I think it's just really important then to, you know, make sure that you're continuing to do the things that we are doing both, or were doing before the vaccine, and then now still after, which are washing hands, you know, limiting contact with large groups of people, masking when out in public, distancing as much as you can. You know, all of those things that we know do decrease spread and transmission of the virus are still really, really, really important. And so I would say just sort of know your risks, and everything is risk benefit, right? So if something feels risky to you, then perhaps it's something that you shouldn't do. I think we're hopeful. We're hopeful that with the vaccine, there's a light at the end of the tunnel, and that sometime in the near future, we'll be able to gather together again. And while things may always look a little bit different, I hope and know that we're not going to be in the situation we're in right now forever. So that's given me optimism and hope.
It sure does give me hope to see that one day we'll get there. But as far as the people that don't want to, people that don't want to get the vaccine, when they're coming into your home, like Julia said, mask up, make sure they're washing their hands. Like people that do not live in your home, make sure they're wearing face covering at all times. And as far as the people that live in those areas where the numbers are still high, and if they coming in to visit, you can even ask them before you come into my home, can you get tested, and have them, like they said, to isolate themselves when they come here. So you can go as far as to that, to make sure that everybody is safe and protected.
Absolutely. Please feel free to reach out to us through our website, through our Facebook site, through our LinkedIn site, any site that you use. Instagram, I think we're on, correct? We've got a lot of different social media that people work really hard to curate. So feel free to reach out to us with any other questions. And, you know, as the science evolves and as the pandemic evolves, we'll be back again with more information.
Thank you for watching the Q&A for Care to Prevent with Takisha and Julia on COVID vaccine. So thank you for tuning in, and hope to see you soon. And if you have any questions, like I said, just follow up on our Facebook page, Instagram, or on our Care to Prevent page. So thank you once again for tuning in, and thank you for Julia for joining us.
Thank you, Takisha. This was a lot of fun. Looking forward to doing it again.
Yes, thank you.